Okay. Good morning, everyone. My name is Patcharanun Borompiyasawat, Master Degree student of Pediatric Dentistry, Chulalongkorn University. Today, I would like to present my research about remineralized effect of chlorhexidine gluconate as a cavity disinfectant on dentin carious lesion, restored with high viscosity glass ionomer cement. Let me introduce how important of our research. A traumatic restorative treatment, or ART, is a method to manage deep caries by only hand instrument to selective caries removal for less trauma. ART was developed mainly for treating caries in children living in underserved areas where resources are limited. The restoration material which is often used with ART is high viscosity glass ionomer cement, or HGIC. The combination of ART method and HGIC helps dental treatment easier, faster, and more comfortable than conventional restorative treatment. The selective caries removal method provides high survival rate, but there are several factors that cause the failure of ART. There are defective restoration, pulpal inflammation, and secondary caries. The factor of defective restoration. The survival rate in 2 years follow-up of single surface ART with GIC was high in both primary and permanent posterior teeth, while the multiple surface restoration show lower survival rate. The new generation of HGIC, such as Equiaforte, is claimed to be used with cavity class 2. Hybrid technology in Equiaforte helps increase fractural strength, which prevents material deformation against chewing force. The factor of pulpal inflammation. Efficacious in deep caries lesion, which was difficult to eliminate, and was known to induce pulpal and periapical inflammation in long term, can be inhibited by 2% chlorhexidine gluconate. And the last factor is secondary caries. Hypermineralized zone of adjacent dentin to the restoration helps decrease the progression of secondary caries. Hypermineralized zone occurs from the exchange of charged ions between restorative materials and dentin, but the mineralized effect of the combination of HGIC and 2% chlorhexidine gluconate is not clear. We would like to find the change of hypermineralized effect with and without using 2% chlorhexidine gluconate. So, the objective of this study is to compare the percentage of mean mineral density difference of Carious dentin at baseline and after cavity disinfectant with chlorhexidine gluconate and restore with HGIC in vitro. Materials and methods. Subject in this study is 7 samples per group. Inclusion criteria. Primary molar extracted teeth with dentin carious lesion with or without pulpal exposure. If carious lesion exposed to the dental pulp, exposure size must less than 1 by 1 mm after selective caries removal. Or if carious lesion did not expose to the dental pulp, a lesion must invade to dentin from visual examination. The remaining tooth structure must be more than 1/3 of the crown, and the roots of the teeth must be at least 1 mm in length. Specimen preparation. We disinfected all teeth with normal saline solution and 10% formalin solution. After that, for horizontal guide plane, we cut the cuts of all teeth like a flat surface, embedded in resin block, and selective caries removal thoroughly with spoon excavator. Label number and random sampling. Odd number was grouped to the equal group, and even number was grouped to chlorhexidine equal group. After that, scan mean mineral density of dentin, by micro-CT as baseline. The samples in equal group were treated with Dentin conditioner 20 seconds before restore with Equiforte and coat with petroleum jelly. The samples in Chlorhexidine equal group were prepared the cavity with 2% Chlorhexidine liquid for 1 minute by microbrush. Then, the cavity was treated with Dentin conditioner 20 seconds before restore with Equiforte and coat with petroleum jelly. All the samples were stored in artificial saliva in 37 Celsius degree for 24 hours before micro-CT scanning. Assessment, the micro-CT scan and data analysis. Scan interested area included the area from the first light of occlusal surface to the first light of the roof of pouch chamber, figure A. Results of scanning were shown as a section in horizontal plane. Figure B showed the first light of occlusal surface, and Figure C showed the first light of the roof of pouch chamber. Figure D shows slide with the restoration. The contrast was set for evaluation the difference in density between HGIC and Dentin. Therefore, the HGIC restore samples were analyzed before the baseline samples. The contrast testing was the average value determined by two calibrated examiners. Then, all slides were generated to 3D, figure E. After 3D construction, the mean mineral density was calculated. The percent mean MD difference was used to perform the change of mineral density of each teeth. Statistical analysis. Chaperovic test and Lesion test were performed for test the normality and homogeneity of variance of the mean mineral density. Comparison of the percentage of mean mineral density difference between before and after restoration in same group was analyzed by pair t-test and between group by independent t-test. Intra-rater reliability and inter-rater reliability with intra-class correlation coefficients. All of the analyses were performed at the 95% confidence interval and SPSS statistic 22. Results. A total of 14 samples were included in the study. The mean mineral density at baseline of equal group was 811.26 mg hydroxyapatite per ccm, and Chlorhexidine equal group was 707.83 mg hydroxyapatite per ccm. No significant difference was detected between the mean mineral density at baseline of two groups. The mean mineral density after restoration of equal group was 925.97 mg hydroxyapatite per ccm, and Chlorhexidine equal group was 916.07 mg hydroxyapatite per ccm. The mean mineral density at after restoration was significantly gained from the baseline in each group. Equal group mineral gain 114.71 mg hydroxyapatite per ccm. Chlorhexidine equal group mineral gain 208.23 mg hydroxyapatite per ccm. The mean MD difference between equal group and Chlorhexidine equal group were 14.59 and 30.90, which was significant difference at 95% confidence interval. Discussion. Results from this study show that HGIC promoted remineralization to adjacent affected dentin, and also found that in group which had 2% Chlorhexidine as cavity disinfectant had higher mean MD difference. This effect is related to some Chlorhexidine properties. Chlorhexidine acts as a barrier to dentin surface by neutralizing the dentin surface, which is applied by acid conditioner. Pathogenesis of dentin Carious lesion originates from dissolved minerals when pH is critically decreased. Then, bacterial acid production stimulates matrix metalloproteinase activation to degrade collagen fibrils of dentin. The function of chlorhexidine is shown to inhibit the matrix metalloproteinase activity, which can keep collagen cross-linking of true structure from collagen degradation. Collagen fibrils were surrounded by extrafibrillar mineral, intrafibrillar mineral, and protein triple helix. They create collagen fibrils to elastic behavior and resist to demineralization. Intra and extrafibrillar mineral also have mechanical recovery themselves, though dentin is partially demineralized. When collagen fibrils are reincorporated with minerals, the remineralization is promoted again. Conclusion: 2% chlorhexidine equal group had higher both mean mineral density gain and mean MD difference than HGIC restoration alone. Consequently, 2% chlorhexidine enhanced the remineralization of adjacent dentin of the restoration. Acknowledgement: the trial was financed by the Grant for Development of New Faculty Staff of Chulalongkorn University, and sincerely thank you to Oral Biology Research Center and Dental Material Science Research Center, Department of Biochemistry, Department of Pediatric Dentistry, Chulalongkorn University. Thank you. ขอบคุณค่ะ
Okay, thank you for your presentations. A very good, nice presentation. This session to the Q&A. Welcome to you all to ask.
Is there any questions? Okay, so thank you very much, Dr. Patcharanun, for your presentations. And I have just, just like a small questions, not that much. Would you please share your idea with us about the clinical applications from your study? Will you recommend to use the chlorhexidine in every case for pediatric patients?
Yes, I think chlorhexidine has a cheap and it's a common disinfectant in dental unit, and the bactericidal activity, I think, is a benefit to use to promote remineralization in affected dentin, because in primary teeth, the ART is necessary in the underserved areas. Yeah.
Okay. Okay, Kat. Thank you very much for the answers. Okay. So is there any questions as well? So if not, I will move to the next topic.